All right, so whenever you're coming up to a ramp, depending on the ramp, so like this one has a little lip, which makes it kind of hard to get up on. So as you're instructing your patient to go up a ramp, if you're practicing with one of these, you want to just tip them backwards and get those front wheels up on there. It just makes it a little bit easier. When you're teaching ramp management, the thing that patients need to be careful of is their weight distribution and that they're pushing evenly with both upper extremities so that they don't end up turning sideways and going back down the ramp. And so whenever you go up a ramp, if you stay leaning back, you're more likely to tip the chair backwards. You'll feel that as you start to go up. And so what you want to have your patient do is lean forward to go up. So, and then once they're up, then they can sit up straight. Coming down the ramp, it is okay to go down forward as long as they're able to maintain control. And you would want to have the patient sit upright. You would not want them leaning forward because that will get them going really fast and more likely to fall out of the chair. And what they'll do is they'll use their hands to slow themselves kind of as little brakes going down the ramp. Now, if somebody is not safe going down the ramp forward, or if the ramp is too steep going down, you can also go down backwards. Now, obviously, you want to make sure you're not going to hit anything, but it does allow you to be a little bit more controlled on a very steep ramp. So whenever you're working on ramp management, you want to be behind the patient, holding onto the handles so that they don't tip. So it's all about weight distribution. And the easiest way to learn to instruct someone is to be able to do it yourself. So what we're going to do now is we'll separate out. I can set up another curb. There's the doorway there. You can also use the doors in the back, although they don't go both ways. And then we have the one ramp. So grab a wheelchair, practice instructing, and then also practice being the patient and just managing all the different moving parts.